Hello, good afternoon. My name is Margarita Moran, and today I will be presenting the research article, The Analysis of the Effectiveness of the Nurse-Led Outpatient Ward Home Management Model in Patients with Chronic Kidney Disease. This research article was written by Qi Hu, Cui Yang, Wei Wang, and Men Meng. So goals addressed in this article is to evaluate whether the nurse-led outpatient ward home model is more effective than traditional methods used in nursing in enhancing the emotional well being, diet and lifestyle habits, medication compliance, and successful rehabilitation after treatment for patients with chronic kidney disease. The nurse led outpatient ward home model will compare the quality of life of patients with chronic kidney disease, reduce symptoms by providing patients with prompt psychological care, enabling them to improve their sleep, empower self management, and to a certain extent, slow the progression of chronic kidney disease. This will be accomplished through encouragement, frequent follow up assessments, special diet, and a healthcare team readily available when needed. Um, so, what is already known, chronic kidney disease is a debilitating disease that results from diabetes, hypertension, and often leads to renal failure, dialysis, the need for a kidney transplant, which is not always available, and death. Which is why chronic kidney disease patients require strict adherence to medication management, lifestyle, and diet changes. In addition, people living with chronic kidney disease often experience anxiety about their diagnosis, which results in depression and sleep disturbances, thereby decreasing their quality of life for them. The progression of the disease depends on the patient's compliance with self management. Previous research and studies. So, a study done in China showed that only a 7.5% of the patients with chronic kidney disease knew how to manage their condition adequately, and this was from a lack of education, then inability to understand how to self manage their condition, and insurance reimbursement coverage costs. Additionally, in the history of China, there has been limited research on how a nurse led team can impact patient outcomes in those with chronic kidney disease. Currently, in the United States, there is not enough data available on how many patients living with chronic kidney disease know how to manage their disease and to slow the progression effectively. However, according to the CDC, 14% of the people living in the US, which is one of every seven people, have chronic kidney disease. So, why was it necessary to conduct this current research? So, not enough research on how to effectively help patients with chronic kidney disease manage their condition. So, there's not enough research out there. Continuous implementation of different nursing practices and research can bring us closer to making an impact in helping patients manage their condition. This would help decrease the mortality rate, allowing patients to stay healthier and slowing the progression to complete renal failure, dialysis, and needing a kidney transplant. It is a model that we can adopt for a more patient centered care approach when caring for patients with chronic illnesses. It also promotes patient safety, teamwork, and collaboration by showcasing evidence based nursing practices that lead to improved patient outcomes. Discussions. Methods used for this experiment was so the research design was quantitative experimental. Um, there was 120 patients with chronic kidney disease. And they were the study subjects. So 60 patients with chronic kidney disease were the control group, and they were giving conventional nursing interventions. The other 60 patients, they applied the nurse-led outpatient ward home management model to them, which they received basic nursing care, but also a little bit extra afterwards post-discharge. Procedures used to obtain this data was 120 patients admitted to the hospital were selected between April 2020 and April 2021. The people conducting the research used the random table method to select the patients. However, they needed to fulfill specific criteria for the study. They had to have a diagnosis of chronic kidney disease, could not have another severe organ disease. Patients needed to be conscious to be able to cooperate with the study. The patient had to be in the clinical stage of the disease between 1 and 3 and more than 18 years old to be able to participate. Patients that were excluded from the selection were patients with mental illnesses, cognitive decline, hearing, visual impairments, communication issues, and other severe comorbidities. Materials used to conduct the study were the patient would self evaluate through different scales. For example, they would use the self anxiety scale, self rating depression scale, the Pittsburgh Sleep Quality Index score, and also the patients would rate their self managing ability through a self management score in conjunction with nutritional status, with the nutritional status, which was monitored through the study by measuring the patient's BMI, albumin, and prealbumin. Also, renal function labs were monitored, including creatinine, the BUN, and the GFR. Ultimately, the patient would self-assess through a chronic renal failure quality of life scale, which is the QLICD CRF 2.0. These scales and scores were administered at the beginning of the study and again 6 months later. The results were compared, revealing positive outcomes for the experimental group. The self the self anxiety scale, the self depression scales, and the Pittsburgh Sleep Quality Index scales used in the study were valuable for evaluating the patient's emotional progress. These tools monitored the psychological well being of the patients and provided an objective measure of their sleep quality and patterns. This information provided nurses with insights into interventions that could enhance rest and alleviate emotional distress. Additionally, self management scores and the nutritional lab values, such as the BMI, albumin, and prealbumin, were critical for monitoring and ensuring that patients' nutritional status was improving. The use of renal function labs such as the GFR, the creatinine, and the BUN was essential for assessing the effectiveness of the tailored diets and implementing interventions to improve lab values and prevent patient decline. Furthermore, using the renal failure quality of life scale is essential because renal failure impacts patients not only physically, but also mentally, socially, and emotionally. This condition affects their daily lives. By evaluating their quality of life score, we can gain insights into care planning and identify unmet patient needs. This information can help us apply nursing interventions that support patients in coping better with their diagnosis and future prognosis. Next, I will walk you through the step-by-step description of how the research was conducted. As I mentioned before, the research was covered over a span of 6 months. 120 patients were selected, and they were divided in two groups. One was the control group, and the other one was the experimental group. In the control group, the conventional nursing intervention, um, on admission, the patients would immediately be assessed and introduced to the nurse, provider, and staff caring for them. Education would be provided at the bedside of their condition. Patient was provided with basic during hospitalization, the patients were provided with basic nursing care such as orienting the patient to the ward, medication reconciliation, edema, wound care, renal function labs, instructions on how to collect a 24-hour urine specimen. Care was focused on patient safety. Patients would also receive weekly group lectures that educated them on their diet and lifestyle changes, as well as kidney disease related information. Patients would also watch a 30-minute video on their diet, medication management, and precautions every morning. During the hospitalization period, the nurse in the care of the patient would also regularly round the patient and respond to concerns according to urgency and solve them. The nurse would also pay attention to emotional changes of their patients during their stay and address them accordingly. When the patient would be discharged, they were educated on precautions and things to do after discharge, and these included medication compliance, following a renal diet plan, regular blood glucose monitoring, and blood pressure. Patients were given the hospital's chronic kidney disease health management manual and a salt spoon to measure the amount of salt they were allowed to consume. Patients were encouraged to return for a review of the information if needed and were assisted in setting up telemedicine follow-up visits. Patients were given the phone numbers of all the nurses and doctors and were prompted to call if they had any other questions after discharge. In the experimental group, the nurse-led outpatient ward home management model, the charge nurse was the leader, and part of the team included doctors, other nurses, rehab staff, and a dietitian. Each was assigned specific responsibilities to ensure the program had a strong foundation and guaranteed that the care program would be effective. In the outpatient portion, they always had a kidney disease specialist nurse on a daily basis to be able to perform systematic assessments and triage patients for admissions if needed. The nurse specialist guided and educated patients on medication adherence, self monitoring their own health, um, lifestyle changes that could be adopted with her condition, and nutritional management. They also provided guidance on rest and sleep and educated them on risk factors and triggers for insomnia. During the hospital portion, if the patient were admitted to the hospital, the attending doctors would immediately assess their condition and the negative emotions of the patients with chronic kidney disease were experiencing. The patient would receive timely care, education, and support until they no longer felt anxious or depressed. Um, in this model, they also offered throughout this process psychological guidance. So, psychological guidance was applied by a specialized nurse who would analyze the triggers of the patient's depression or anxiety through intensive interviewing and would work with the patient by through encouragement, providing comfort and therapeutic communication. Patients were provided with science disease related videos for a limited time only, along with pamphlets and given health education on chronic kidney disease. So, for the patients who had already progressed to end stage renal failure, the nurses used specific food models and the types of food and the amount of food that would promote a healthy choice for patients with chronic kidney disease end stage. The dietitian in the study and the experimental group used the patient conditions, biomedical indicators, blood pressure, dietary habits, and family and economic strengths to tailor the patient's diet to prevent malnutrition and increase their protein as tolerated. Upon discharge, which was the home management portion, the nurses created a group called Weibo, and in there, the patients would be able to ask questions. They would be able to the nurses would be able to answer these and help patients with problems they could assist with for the chat group. In this group, patients would also receive continued support through encouragement with continuous provision of information related to chronic kidney disease, helping them stay informed and educated on their rehabilitation, medication adherence, and self management. Additionally, they would receive ongoing psychosocial and emotional guidance. So in the WeChat group, the nurses implemented to follow up with the patients post discharge at day 3, 2, 4, um, and 6 weeks, and at 8 weeks and at 12 weeks. And the follow-up visits would be added according to the patient's needs. At the follow-up visits, the nurse would assess patient's emotional state, self-management practicing skills, understanding of medication compliance and adverse effects, and they would relay this information back to the provider for and dose adjustment if necessary. At the follow up, the nurse would also evaluate the patient's self management compliance, monitoring according to the patient assessment. Patient goals would be established, and continued telemedicine follow up appointments would be necessary to maintain this communication with the patient. If a patient had any problems or concerns, such as questions about their diet, treatment, and rehabilitation, the nurse could not address immediately, the nurse would communicate these issues to a team of specialists on the same day. And additionally, the doctor would offer guidance and maintain records to monitor the patient's progress. Procedures used for data analysis. The data analysis was entered into an Excel sheet by the researcher and a person not related to the experiment. All the information was double checked, and the software used was SPS 21.0. To compare data from the initial baseline data, the chi-square test was implemented for count data. So the research results and findings were as follows. Patients in the experimental group demonstrated lower scores of 0.05 in anxiety and depression, and the ability to have better sleep improved, providing that the nurse model does have a positive impact and helped improve patients' emotional state and address sleep quality. This was effective because a specialized nurse would carefully assess the psychosocial needs of the patients and plan goals that would enhance positive emotions through exercise, proper medication, nutrition, and connecting the patients to a counselor during their treatment. This fostered rapport with the patient and helped the patient feel supported, easing their mind and helping the patient build the confidence that they needed to self manage their condition, allowing them to relieve anxiety and depression, which resulted in the patient's improved sleep quality. The BMI, albumin, and prealbumin levels were higher 6 months after the nurse's intervention, which was a 0.05 increase. This was achieved through continued nurse education, nutritional guidance, as well as helping patients identify and modify unhealthy food and lifestyle habits, helping them overcome their challenges through guidance and education that changed their behavior and led to healthier food habits, ultimately improving their nutritional status. The GFR, serum creatinine, and BUN also revealed a decrease in their levels, indicating improved renal function. This was attributed to the strong commitment of the nurse led model in educating patients on their medications and compliance, as well as educating patients about nephrotoxic medications that could exacerbate their condition. The nurse would guide patients on making diet and lifestyle changes and adopting good self management behaviors. The study shows that after 6 months, patient scores of for self-management, physical function, treatment management, and the quality of life improved significantly higher by 0.05. This indicates compliance with treatment and satisfaction with the quality of life during the research period. So further research conclusions, the results indicated that a nurse-led outpatient healthcare management program was more effective than traditional approaches in caring for patients with chronic kidney disease. Close monitoring, especially after rehabilitation, can help prolong the progression of chronic kidney disease, enhance self management abilities, improve psychosocial well being, and increase treatment compliance. Additionally, it can lead to better sleep quality and an overall improved quality of life for chronic kidney disease patients. These outcomes were achieved through ongoing education and support after discharge, as well as encouraging patients to take an active role in managing their own care. So the significance of the nurse-led outpatient ward home model is important because it emphasizes its holistic approach to patient-centered care, which prioritizes the treatment of individuals as a whole rather than just a patient. This model deeply addresses both the physical health and psychological well-being of patients, emphasizing the importance of the patient-centered care in nursing. In the study, through patient advocacy, education, and commitment to facilitating continuity of care, the interventions were tailored specifically to the unique needs of each patient. The implication for nurses are that a patient-centered care approach must ensure that patients' voices are integrated into care planning and that patients should be equipped with the knowledge and skills necessary for them to actively participate in managing their own health. Follow-up care was essential for ensuring patients' long-term well-being. Programs like WeChat and telemedicine serve as a powerful tools to enhance ongoing communication after discharge and improve follow-up practices. This supports this support helps empower patients and strengthens the continuum of care, preventing them from falling through the cracks. The model shows that nurses can play a crucial role in facilitating a smooth transition from the hospital to rehabilitation and ultimately back home. The study also emphasized the importance of teamwork and collaboration in the special nurse led program, which through collaboration ultimately enhanced the patient outcomes. For nurses, collaborating and addressing potential complications early is crucial in improving patient outcomes. Evidence based practice demonstrates that by implementing targeted nursing interventions and collaborating, we can deliver quality care promptly and ensure that patients receive the support they need. This study framework in nursing practice not only demonstrates the effectiveness of coordinated care, but also serves as a valuable resource for developing innovative nurse led programs in the future within the healthcare system. This is especially important for patients dealing with chronic illnesses that need extra consistent education and encouragement throughout their rehabilitation and prognosis. As a result, this research provides nurses with evidence-based insights that they can use to advocate for their patients. This in turn creates enhanced leadership opportunities within the nursing profession and fosters a more supportive environment for patient health and well-being. Additionally, it is essential to consider, some weaknesses or biases. Two that I identified were the inability to determine the long-term effects of chronic kidney disease, um, on how the nursing model influenced the progression over time. The follow-up period was only 6 months, so if the follow-up period were lengthened to 1 year and then continued as needed for a longer duration of at least 1 year, it could provide a clear understanding of the overall real prognosis and disease progression for each evaluated patient. And I believe the it would also it would be greatly benefited if the study would because the study was only conducted in one region, but it would be more beneficial if the survey or the study were conducted across diverse hospitals and demographic areas. The results obtained would be analyzed and refined to create a dynamic model that is adaptable and suitable for any patient. This method enables findings to reflect the needs of diverse populations, supporting the development of tailored applications across various clinical settings and regions. Because the incidence and progression of chronic kidney disease are significantly influenced by factors such as diet, the quality of life of patients, comorbidities, and the availability of resources like screenings and education. By applying this model in various demographic areas, we can implement beneficial changes that are tailored to meet specific needs of patients in different areas. Thank you so much for listening to my video today.